Oh, so welcome everyone. Really good to have you all here for this special session brought to you by Saybrook University, our hour-long mindfulness moment on the applications of mind-body medicine for long COVID. And so it's really such an honor to be here and talking about this topic in some depth, as I have both personal and academic ties to this topic and this work. So my name is Dr. Shaelyn McLain, and I'm an assistant professor with Saybrook. And I just want to say this presentation is really special to me for a few reasons, and one of which, all of the beautiful artwork that you will be seeing here in these slides are come from Claudia Bueno, who is a friend of mine and also such a beautifully accomplished artist. And so it's really such a pleasure to bring her work into this conversation. So let's get started. And as I'm going through this, feel free to be dropping thoughts or comments or insights in the chat. I will be doing my best to look at that as I can, manning the screen here. Okay, so here's really where we're going today. It's going to be a full hour together. So wanting to start, of course, by us dipping into an understanding and really a definition of long COVID. This is something that I think we're hearing more and more about as we progress through the era of COVID. And although this is my world, recognizing that this could be a new term for some people. And so we'll talk about that a little bit, what it is. And then we will dive into also what mind-body medicine is and how it so perfectly, has these applications for long COVID, right, which is the primary theme of this talk today. And we'll explore some of the evidence-based therapies, mind-body practices and therapies, and how they can be used specifically for long COVID. And then I will end with some supportive resources and a whole bibliography with my sources, and that may be of interest to you as we get into this. Okay, so let's talk about long COVID and what it is. So this is a term that's really made its way into our lexicon since the emergence of COVID-19. And so it's actually now, and has been for a while, considered a clinical condition. And it's characterized by the persistence of symptoms for 12 weeks or longer following a COVID-19 infection. And it includes a really wide range of ongoing health problems that can last from, weeks to months, or for some people, even years. And so there's some statistics that are being regularly updated, but really the current projection in the prevalence of long COVID is around 6 to 10% of the US adult population that has been infected by the virus. At one point, I saw this statistic, as high as like 20-something% or even 50%. I think I saw at one point. It depends on the source of where it's coming from. But I was pulling this from the CDC. So as a society and as a medical system, we haven't really quite decided on a term for this condition. We hear pretty commonly, I think, that it is referred to as long COVID, but there are some other names that this is known by, and maybe you could be familiar, possibly, as post-COVID condition, PCC for short, long-haul COVID, post-acute COVID-19. These are really a mouthful, right? Post-acute sequelae of SARS-CoV-2 infection, or PASC. You often might hear that shortened as PASC, and then chronic COVID. So all of them are correct. In my view, though, I do, resonate with long COVID being probably the more common term. And so what we're, for this reason, right, we're having multiple definitions of long COVID. It does make it a bit challenging to research this phenomena when we're struggling to land on a precise definition. And research is constantly emerging around the pathogenesis of this disease and potential treatment pathways, which I'm really excited to talk a bit more about later. So the research is really suggesting that long COVID is caused by chronic inflammation and immune dysregulation in the body. And we're going to go into more detail with that. But we're learning that there are some really significant neurological complications that are associated with long COVID, which can certainly explain lots of symptoms that go along with this condition, like brain fog and cognitive impairment, and many other symptoms that long haulers face. And interesting to note is that we see long COVID is very similar to a condition called ME/CFS. So that's myalgic encephalomyelitis chronic fatigue syndrome, ME/CFS. So this connection and distinction has actually been made pretty early on, as we're seeing quite a lot of overlap. And so it's been interesting to follow some of the guidance and really effective strategies that some people are experiencing from the ME/CFS world in terms of, just how to manage their symptoms and really pace themselves through this condition. So due to that fact, we're actually seeing that, ME/CFS treatments can be really helpful for long COVID. And again, we'll talk about that a bit more in detail later on. And so what has really been clear to me, and I had my own experience with long COVID, and this continues to be supported by the research, but regardless of any treatment pathways that emerge, long COVID extends beyond physical health. It has to do with our physical health, certainly, but it touches into every area of our life. So many people have difficulty with, professional lives, with their social lives. And so what feels so clear to me is that a holistic, integrative mind-body approach is so necessary when we're talking about chronic conditions, and especially long COVID. And so what do I mean by that? Well, that's really what we're going to be talking about today, and how we need to look at the whole person and the whole body and all of the bodily systems, how they function together. Because it's not just about the body and the symptoms that emerge there, but it's also about how the mind is processing what is happening, and also that psychophysiological relationship between health, long COVID, and wellness. So I thought this was, wanted to bring in an image here that helps describe, or at least bring some imagery around, like, all of the different types of bodily systems that are impacted by long COVID. So this is one of the better ones that I could find, but it is not a complete list of symptoms or even ways in which long COVID can impact the body, but I think it gives a pretty good idea. So as we can see here, and I won't read through all of these, but as you can see, long COVID is really touching into every single system in the body, from mental health, being a huge one, how there are like actual clinical and neuroscientific ways that long COVID is impacting the brain and actually changing the structure of the brain. And so this can explain a lot of the debilitating memory challenges that people face when they have long COVID, including, brain fog. Brain fog, as you talk to some people who actually are living with long COVID, it's like, that doesn't even describe it. It's like this all-encompassing, just like terrifying loss of memory. And just, you cannot remember the simplest things. I had this experience. This is one of the biggest challenges for me. And as you can imagine, someone who is just come through graduate school, who just graduated with their PhD, suddenly can't even remember the simplest things, like where the spices were in my kitchen where I'd been living for 5 years, things like that. And of course, then this ties into feelings of anxiety and depression. Respiratory system, that's one that we hear a lot, right, with COVID, that it impacts our ability to breathe and the whole respiratory space. And all of these other, areas from, GI discomfort to actually skin disorders, feeling the nervous system is a huge area of this. And we can definitely talk about that. And I will actually go into more detail around how COVID and long COVID is basically dealing with a dysfunctional autonomic nervous system. But this is also where we see the strokes, really debilitating headaches and migraines, again, memory issues. And, cardiovascular, we hear quite a bit about that. But then also it affects our endocrine and metabolic system as well. And many others. So some of the other bigger symptoms include malaise and fatigue, like this debilitating chronic fatigue, and mitochondrial dysfunction, right? So mitochondria being these energy centers in our body. And when they are not functioning correctly and not producing ATP, or that energy to give to literally every part of our body, there's a dysfunction on the cellular level. And there's been some really interesting and encouraging research coming out around this, that we're actually finding the specific ways in which long COVID is impacting the mitochondria. And so I feel this is encouraging, because then we can actually have some targeted treatments that help to really boost and repair and help our mitochondria, give the ATP and create the ATP and send that out to our bodies. So again, like, it's worth noting that these are physical and also some mental challenges and symptoms that we see as a part of long COVID. And I think there's somewhere around, I think, over 200 symptoms that are technically classified as long COVID. So this is not a comprehensive list. It really touches on the bigger areas. But also, right, there is a psychosocial impact that's happening here as well, and challenges, as you can imagine, right, in performing everyday activities like self-care and household tasks, shopping, engaging in social activities, inability to work. I mean, this is a huge one. So even just driving a car is challenging and not possible for some people, particularly those who are dealing with a lot of neuromuscular or seizure-like symptoms, where it's just not safe for them to drive. And how this truly changes your life when you're suddenly not able to do some of the most basic things that you used to be able to do without even really thinking about it truly. And so there's a lot of, and I'll say that there's such a range of severity and symptoms, and not everyone has every single symptom. And to the most severe degree, there's quite a range of severity here. But there are some folks that I work with who really are on the more severe, debilitated, disabled side of this spectrum. So it's very individualized in terms of how people are affected by COVID and what makes up their long COVID landscape for them. And again, this does make it quite challenging from a medical perspective to diagnose and to treat a condition that has potentially over 200 symptoms. So we're not just talking about, a few isolated ways in which this virus impacts the human body. So I can talk about, how this experiences for some people who are living with long COVID, but I want to actually bring in some voices of people who have been living and in some cases still living with long COVID many years after they had contracted the virus. So I wanted to play this video for you all. It's about 8 minutes long, and just to hear from some long haulers. And I put this compilation video together maybe about 2 years ago now, but it's still so very relevant in the landscape of long COVID and how we see people are being impacted by this.
Tested positive October 16th of 2020 and have been sick ever since.
I blew it off because at first I didn't match the symptom list.
On the one hand, I was a mild case, right? I didn't have the extreme symptoms. I actually never lost my sense of taste or smell. I had the horrific headaches that some people talked about. And it was a low-grade fever, but it was so relentless.
My heart was racing in different ways, different times, with instructions of if you feel like it's not alleviated in 4 hours, just come to the hospital. If not, there's nothing we can do for you.
And I did not know anything about long hauler post-COVID syndrome, that, it wasn't even talked about.
And then I also have all the brain fog that everybody has, hard to find words. Short-term memory is pretty much gone.
And that same day that I got my results back, I started to run a fever. And then I proceeded to have a fever for 54 days.
The GI problems were getting worse, so I wasn't wanting to leave the house. I was having migraines 4 or 5 times a week that kept me in bed in the dark.
A friend and nurse that said, have you checked into long haul COVID yet? Like, no, we haven't even heard of it.
This one is different. That's what I kept saying. And boy, it was different. I wasn't able to walk or manage. I used my limbs freely. I had no coordination or strength.
There were ER visits. There was a neurologist. And at that point, it had been over 6 months.
I was the type of person who just pushed through. I've worked through the flu at 12-hour shifts. Why do I need to stop for anything? Was my mindset. And this has completely drastically changed how I think about my health, how I think about how I should respond.
Tons of autonomic issues, low blood pressure and fainting and the blood pooling and the whole gamut. And then that rolled into this never-ending fever. I'm still with a fever today.
The virus in my body has started to eat away at those nerves in a way, very basically speaking, so they don't send or receive the correct chemicals at the correct time.
And I could not function normally.
But it definitely does not feel like you have control.
My heart is just so saddened with the amount of people that are going through long haul COVID.
Maybe not full-blown depression, but I was down and struggling, and that sort of no end in sight feeling, everybody checking on you, meaning well, and of course you're grateful, but you keep feeling like, yep, nope, not better yet, not better yet. And it's really, I think people underestimate how hard that is on the patient.
I would go to bed with my room set up in a way that if I didn't wake up, my family would not, like there was not things everywhere. And that's a hard place to be. And in the middle of this, I'm going to work.
There have been days where I don't want to get out of bed because I can't face it. There are days I want to give up.
But it was just a very confusing and sad time, and scary. There were many nights I went to bed, and I'm not exaggerating, I didn't think I was going to wake up.
Feeling pretty defeated at that point because, I didn't have any help. What's going on? What's the next step? And it was rough. It was really rough, obviously not being able to get up and do what you want, and all the loss that comes with it, all of it.
It is hard. I'm smiling. I put makeup on. You know, but like I shaved my head the other day because my hair is falling out so much. And also, I don't have the energy to deal with my hair. I don't even have the energy to put it up in a ponytail anymore.
I may not be able to return back to work, and I've got like 8 weeks. And that has created a lot of fear, uncertainty.
You know, my heart just really goes out to all the long haulers who, they don't get support, they don't get the knowledge that they need.
But you feel like you can't tell people what they want to hear, and you don't even know what to tell them. And with COVID, the doctors don't know what to tell you. There was no set treatment protocol. Everybody has been so different. The list of symptoms is so vast, and varied.
Trying to find the correct doctors who understand and can properly treat or even be willing to hear our stories as long haulers has been part of the struggle for me.
It's heartbreaking when your family doesn't believe that you can't function, when your friends are like, you can't be that tired, so-and-so had COVID and they're better now, or whatever. I don't know what this is, where people's reaction is to minimize or be kind of a Pollyanna of, oh, just be better. Validate and just believe them. Nobody wants to not feel well. So I would just urge everyone to please listen to the patients and believe them and ask them how you could best support them.
There are people in your life that are gaslighting you. It happens all the time.
We've all heard the term medical gaslighting. I had not until this happened to me.
Being told that it's in your head, or you should do this more. Da, da, da.
And I just learned to listen to my body, and that's really, I think, what was the best thing for me, to learn to listen to my body when my body had had enough to stop. And of course, most of the time that was hard because I didn't listen to my body till it was too late. And then I'd have these huge setbacks for days where I couldn't even get out of bed.
So every day you have a humility lesson in what are you able to do for the day.
There's way more to listen to in our bodies than what we realize, and I'm beginning to see that.
I will tell you, this is the lesson I've had to learn over and over, and I'm getting better at it. But I listen to the whispers.
We really do have a group and network of people who are going through the exact same thing. And so I think the first thing is, no, you are not alone. And this will not last forever. It feels like it will. But, we're humans, and we are made to prosper and to survive, and we will live through this, and we will be stronger for it, and we will be more compassionate, and I think even better people for having gone through it, because our story will be able to help others, and we'll be able to bring others out of that darkness with us and say, no, there is hope, and there's a light at the end of the tunnel.
But the coping and the dealing and the overwhelm, take it day by day. If you have to, take it hour by hour. If you need to break it down to minute by minute, advances are being made every day.
There is hope. There are resources, and there's way more resources and hope now than there was in 2020 when I got sick.
Treat yourself like you'd treat your best friend or your spouse. If your spouse was suffering, what would you tell them to do? Or your best friend or your parent or your child. And treat yourself as you would treat those closest to you.
And as long as I'm 6 feet this way instead of this way, I'll use it. My voice to make, those voices that have died not be in vain, and also to make whatever awareness for the poor people that have heard for so long with these silent chronic illnesses.
And you really have to push the negativity away, because that'll just wear on you.
We need to be heard, and there's, a lot of us talking can make a loud noise.
Take it day by day, and don't forget to breathe and drink water.
So hopefully that brought some further insight and just voice behind what the real lived experience can be like for some people living with long COVID. Oh, it's been a while since I watched that video all the way through, and really bringing up some some memories and emotions for me. I found my way to being really connected with this right here, the mind-body connection and long COVID, because I went through long COVID at the very beginning of the pandemic. So from early 2020 into 2021, about a year of so much of what these beautiful women were sharing in this video was so much of my experience, and and then some too, right? This is just a little snapshot of what life can be like. And so at the time, COVID-19 being this brand new virus that's taking the world by storm, and getting sick with it myself. And then after several weeks feeling, oh, I'm getting better. Oh, wait, I am not getting better. I am getting worse in some ways. And realizing, well, what do I do? We don't have a protocol for this. We don't have treatment for this. Can't even go to the doctors because this is just as new to them as it is to me. And long COVID was not even something we talked about. I mean, it wasn't even a thing yet, until we start realizing that, wait a second, there are a lot of people who are not getting through this as easily as some other people. And so for me, I thought, well, what do I have? I have my mind-body tools and practices, and I used those, some of which I'll talk about here a little bit later, to really support myself in a way that I have never had to support myself before. Go deeper into my own self-inquiry, dive so deep into this place of self-compassion, thinking I was a fairly self-compassionate person. Oh, no, not until you are dealing with a debilitating chronic illness do you realize the ways in which you can be very, very hard on yourself. And so when I talk about this mind and body connection, right, I was dealing with, cognitively, mentally, emotionally, spiritually, trying to grapple with, meaning make, understand, work my way, process through what was happening to my body and the drastic, life-changing symptoms that I was experiencing. But as was said in this video, really feeling even better having gone through this, because now I can see the way in which mind-body medicine really is the perfect antidote for what we're dealing with here with long COVID. So, of course, to define our terms here about mind-body medicine is really recognizing that the mind and the body are not separate, but they work together to create our sense of health and well-being. So that is to say, what we feel in our bodies affects our thoughts, and how we feel in turn, what we think and what we believe impacts our physical functioning. So really, in simple terms, right, mind-body medicine is about leveraging that connection between the mind and the body to enhance our well-being. And we use a variety of evidence-based tools and modalities to empower the individual, to show them that it is possible to make meaningful and lasting change to their health. So I'll talk about some of those tools here in a moment, but essentially what we're focusing on in mind-body medicine, or at least how this really translates into my work with mind-body medicine, is regulating or re-regulating the nervous system. It's all about the nervous system. And so why is that important for long COVID? Well, I really like to think of my work here with people who are dealing with long COVID and applying this mind-body medicine is, essentially I'm rebalancing the autonomic nervous system, which is the way that we maintain balance in our bodies and in our minds. And so it's worth just going into here momentarily the two branches of the autonomic nervous system. We have the sympathetic nervous system, which really helps us take quick action. It's that fight or flight response, right? And then we have that other branch, which is the parasympathetic nervous system, our rest and digest, our relaxation response. So basically with COVID-19, what that virus is doing to our bodies is it is dropping a bomb on our autonomic nervous system. It is sending that sympathetic fight or flight response into overdrive. The body doesn't even know why. It just starts manifesting all of these, if we go back to our symptom list and break down really what is the impact of an overactive, hyperdrive, sympathetic fight or flight nervous system response, it triggers all sorts of every one of these symptoms we can really point to, this is what happens when our nervous system is out of whack. And so again, I was sharing that during my long COVID days and before any of the research came out, before we even had a term to describe what this was, I could literally feel in my nervous system this virus taking hold, and I could literally feel this virus moving through my body in this way. I could feel that disruption in my autonomic nervous system. So really an interesting place to be from this cognitive researcher academic mind of, yes, I can logically explain the anxiety, the panic attacks, the brain fog, the cognitive issues. I can explain the GI discomfort and the difficulty breathing, all of this, the high heart rate, the dyspnea, which is running out of breath for simple things like just standing up from the couch to walk to my kitchen, breathlessness. It's like, I can see, what's happening and how the autonomic nervous system is playing a role here. But it's an entirely other thing to know that up here in the mind, but then be feeling it and witnessing it and experiencing it in the body. But then I thought, well, I have tools, mind-body medicine tools that directly come in and press the reset button on the nervous system. So let me do that. If there's nothing else I can do, I can lay here on this couch and I can meditate and I can breathe. So all that I was feeling in my body, it's now really a lot of this is coming forward to be supported in the research. And we're seeing clinical studies and, matching this anecdotal evidence. So right. And again, too, with the chronic inflammation, we're seeing the body and the brain becoming inflamed. And this is also, lighting a match on that sympathetic nervous system. So in my mind, right, this makes all the sense in the world why, the experience of long COVID is really about navigating a haywire nervous system. And the aim of mind-body medicine is to re-regulate the nervous system. And so for this reason, and what I've been saying this whole time, is why I truly believe that mind-body medicine is the pathway towards long COVID recovery and restoring health. So let's talk about some of those mind-body practices that can be helpful, and then also why they can be helpful. So this is not an exhaustive list by any means, but wanted to bring forward some of the main tools that I personally found benefit in, so that's one reason I'm bringing it in. Second reason is some of these that we're seeing promising research coming forward in applications for long COVID. And then three, those that I tend to find some success with in my clinical work and actually working and coaching with folks who have long COVID. So meditation, it's a big one. This is one of the first ones that I thought, yes, I'm having memory issues, brain fog, cognitive challenges. So, well, we don't have any research yet about long COVID, but we do know from decades and decades of research that meditation actually changes the way that the brain functions and actually improves working memory and attention and focus. So I thought, I'm going to do that. I'm going to do more of that. I was meditating already, but I'm going to do more of that. And so now we're seeing more research coming forward, of course. Heart rate variability biofeedback, or HRV biofeedback. I have a whole slide later on in this talk because this is really one of the more fascinating areas, I think, of how this work can be applied to long COVID, and particularly the ways in which we're working with the nervous system. So I'm going to talk about that quite a bit more here in a moment. Guided imagery or guided visualization. So many ways that this can be used, but the ways in which I used it was for repairing the immune system and really healing my body, imagining my body was healing. And progressive muscle relaxation, so PMR, this involves systematically tensing and relaxing different muscle groups. And what we're doing is promoting relaxation and reducing muscle tension. So this one can be really helpful for managing symptoms like muscle pain and muscle spasms or even neuropathy. Acupuncture, so love seeing some research coming forward on this, is some individuals with long COVID have reported benefits from acupuncture, which is a traditional Chinese medicine practice. And then movement, so Tai Chi, yoga, grounded exercise therapy. So I say this with a caveat because it's really important with long COVID that we do not push through the fatigue. We do not just push through the symptoms of pain or discomfort. This is really where we see that connection between long COVID and ME/CFS. It's the same here, is that we see a lot of people who actually have exercise intolerance and post-exertional malaise, or PEM. So it's important that actually pushing, whereas in some cases, kind of pushing ourselves, encouraging us to move through discomfort can be beneficial. It is absolutely not for long COVID. And in fact, it can be devastating to do that, which makes it very challenging, because how do we find that balance without pushing ourselves beyond the edge and then causing ourselves to, our symptoms to flare and actually, set ourselves back in our recovery. And this last one here is super interesting to me, vagal or vagus nerve stimulation. And there's several, this is a larger area, that can include many different types of modalities and non-invasive practices, but, listed a few of them here: diaphragmatic breathing, auricular transcutaneous vagus nerve stimulation, which that's a mouthful, but what it involves is sending mild electrical stimulation to the auricular branch, so access through the ear. So the auricular branch of the nervous system. So there's a really cool study that I love, maybe more at this point, showing some real promise for this particular modality with long COVID. So some studies, and this one that I'm referencing specifically, suggest that TVNS may have anti-inflammatory, neuromodular effects, so potentially offering benefits for conditions dealing with autonomic nervous system dysfunction, which is COVID or long COVID. And long COVID is not the only autonomic condition with a dysregulated autonomic nervous system. We have the whole area of autoimmune disease, which in some cases long COVID is considered autoimmune condition because of that. Anyways, some other potentially helpful practices are cold exposure and singing and chanting. So again, these are all practices that really tap into the vagus nerve and tap into the nervous system. Let's see. So, yes, let's move on. So, I do want to, before I get into this too, wanting to speak again, just to reiterate, how long COVID is really a complex and multi-systemic condition that impacts every single area of one's life, which again really further highlights the need for a comprehensive treatment approach that addresses the whole person, mind, body, and spirit. And so there's been some really promising research on the effectiveness of mind-body therapies, such as mindfulness training for improving mental health and physical function while reducing symptoms. So research on these various modalities is quite expansive, but when it comes to the applications of long COVID, I'm really excited too about this area of heart rate variability, or HRV. And this is one that's been getting a lot of attention, and for good reason, I definitely think, because it is one that's incredibly effective at tapping into the nervous system. So HRV is an important indicator of our overall health, and it's frequently used to evaluate the state of really what's happening in our autonomic nervous system and how well our bodies are handling the stress in our lives. And living with a chronic condition is stressful. It's stressful to our bodies. And the condition of our health is largely driven by the condition of our nervous system. So we see this relationship here. So when the nervous system is working properly, we can feel like we are in good health. But on the other hand, if it's out of balance or dysregulated, we can experience some health challenges. So boosting HRV has been found to be particularly beneficial for chronic illness because it affects the autonomic nervous system. And HRV is a non-invasive way of measuring nervous system activity, which our nervous system, it controls many of the body's vital functions, including heart rate, breathing, digestion, which coincidentally, right, are all very much a part of the long COVID experience, dealing with challenges in these areas. So improving our HRV, or having more variability between heartbeats, is associated with a greater ability to cope and recover from stress, and including chronic illness. So there's a few factors I wanted to go through here about how several factors that can impact our HRV, and including certain health conditions like long COVID. So identifying, and this is where we see this can be helpful specifically with long COVID, is identifying the severity of symptoms. So people with long COVID, typically have reduced HRV. And so boosting this can help, or actually just even looking into this window and seeing what HRV is like for people, can help to identify the severity of the dysregulation in their body and really help them move towards recovery. It can be helpful for managing stress. Again, I talked about, and as you can maybe deduce from this, it's very stressful to be living with long COVID. Improving cardiovascular health. So long COVID really has a negative impact on our cardiovascular system. So HRV can help monitor the cardiovascular system and monitor improvements there during recovery. And this can be helpful too when it comes to bringing in some sort of exercise or movement, because again, post-exertional malaise is something we really have to look out for with long COVID. So lots more I could say about this, and I actually did include in the bibliography, I wrote a whole blog post on this that goes more into depth with this. So if you're interested in that, we'll take a look at the bibliography and you can read it more in detail. Okay, so been talking a lot about this and now want to bring you into some experience with a tool that I actually developed to help people who are living with long COVID. And I'll say this can be a very relaxing and beneficial practice for anyone, but I'll explain why it's particularly helpful for long COVID. Because again, we're talking about the nervous system. So this diaphragmatic vagal repair method is two parts, somatic healing touch, where we're actually encouraging a lengthening and softening of the diaphragm, which ties right into that relaxation response. And then we do a certain form of breath work that helps, again, to further relax and calm and soothe the body. So what we're doing here is seeking to override that overactive nervous system, that sympathetic fight or flight response, which many of us without long COVID can be in that space, right? With just with daily life. So this practice kind of comes in more of a therapeutic way. So, so if you feel called to engage in this practice, please feel free. So before kind of closing your eyes, be helpful to actually watch and see. I'll also try to guide with my words. But what we're doing is first, we're going to be taking 2 fingers on either hand or both hands. And then we're going to be placing these 2 fingers right at the base of the sternum where the ribs kind of meet together, right at the base of that sternum, the breastbone. And we're going to be taking these 2 fingers and pressing in slightly. And the movement will look like this, just a slight pressing in and pulling down towards the belly button. So what we're doing here is using our fingers to really encourage a lengthening and stretching of the diaphragm, which is this kind of balloon-like structure that helps us breathe, and it also helps relax the body. So just for a few moments here, we're going to be doing that, pressing in, just pulling down towards the belly button. Pressing in and pulling down. And you might even imagine here that you're kind of stretching Laffy Taffy. And it's not so much that it's painful. We don't want to have any pain here. You might even find that you can kind of pair this with your breath, maybe using that breath to help kind of lengthen and relax that diaphragm. And so you can continue doing this if it feels good, but at some point I'll invite you to drop the hands away, release the hands, and just take a normal breath or 2. And just see if you can notice any difference in the spaciousness of the lungs and kind of the ability of the lungs to expand a bit more. And if not, that's okay. Sometimes it takes a little working with, depending on how tight our diaphragm is. But we'll shift into this second part, which is the breath work. So again, real simple practice here. And you can keep your eyes open or closed, whatever feels good for you. To inhale through the nose. Hold for just a moment at the top. And then exhaling the breath through the mouth, through pursed lips. Almost like you're blowing out a candle or blowing through a straw. And so breathing in this way, inhaling through the nose, pausing for just a moment. Exhale through the mouth, through those pursed lips. Again, what we're doing here is encouraging a further softening, further relaxation of the nervous system. And talking about the importance of stimulating the vagus nerve, which is that key player in our relaxation response. We're pressing that reset button on the nervous system by doing this. And I'll invite you to bring this practice to a close as it feels good for you. Not spending too long here, but just getting a sense of this practice and if it may be something that you want to continue bringing into your own space and your work with others, perhaps. Again, I have a link in the bibliography section to a longer piece that I wrote up about this practice, and then some informational videos just again on how to do this, and then actually a guided practice. So to round out our time here today, I wanted to just touch briefly on again some of the other slices of this holistic pie with regards to nutrition and lifestyle factors that play a role in long COVID and just really generally in life and wellness, I think, but some reasons specifically why it's very, very good for long COVID. So long COVID is inflammatory in every way possible. So focusing on an anti-inflammatory way of eating, particularly reducing any sort of histamines in the diet, has shown to be quite helpful for long COVID recovery. So I'll often in my work, in my coaching work with long COVID folks, we do our coaching and our mind-body work, and then I also have them connect with an integrative nutritionist as well to handle the nutritional side of things. Sleep hygiene, again, tuning into our sleep patterns. Sometimes sleep is really hard. There's this COVID-somnia, as it's kind of colloquially been termed, challenges sleeping. So like focusing on being routine with our sleep and just attending to that can be very supportive. Things to do with the gut. We see lots of disruption in gut microbiome, primarily, again, with the vagus nerve. This is an emerging area of research suggesting the connection between the gut microbiota and the vagus nerve. The gut is also a significant part of the immune system, and it contains a large number of immune cells. So really focusing on health in the gut is very helpful. Supplementation, and I have a slide on that just briefly in a moment. And then, want to speak to this importance of integrative healthcare, because it's so valuable to build a team. And what you may have heard some of the folks talking about in that video about medical gaslighting. This is a term that I also became much more familiar with going through long COVID and then dealing with this long COVID space of, going into a doctor's office and being dismissed or being told it's all in your head or that there's nothing really wrong with you. So just diluting your experience, not believing you. So that's a real challenge that a lot of chronic illness folks deal with, and especially long COVID. I had to remember, that we're all learning alongside each other, even our physicians and doctors and medical professionals. So it's super important to find someone who wants to listen to you and to work with you and to support you and listen to your needs. And it can be real helpful to, building this team, right? So having a nutritionist, a wellness coach, a physical therapist, a counselor, all these different, areas, building that healthcare team to really support you in all the ways. Okay, and then I just want to talk about this, briefly. I am not a nutritionist or a naturopathic physician. However, I continue to work extensively with a naturopath, and some of these, following the research and my work with clients, and also naturopathic insight, to come up with a few supplements that can be, what we're seeing to be really supportive for long COVID. Again, this isn't like a, one size fits all. There's quite an individual approach that goes to tuning into our health. But these are just a few that can be helpful, and why. So ultimately what we're dealing with here and why long COVID actually even exists is because the spike proteins are penetrating the blood-brain barrier. And so that's one reason why we see these long-term symptoms. So along with lifestyle and mind-body medicine tools, supplements can be another way to detox and break down those spike proteins. If you want to, if anyone here or watching the recording is interested in a more specific protocol for this, that's coming from naturopathic research and medicine, email me. I put my email there, and I can send you the protocol. Okay, and then just a few resources that I wanted to include here for those who are interested, either for yourself or maybe you have folks that are like, this person may be going through long COVID, and what can I do to help support them? And so I have Isla Health is actually the integrative virtual healthcare platform that I work through and do my coaching work with long haulers. So one thing that I do is weekly on Wednesdays from 9 to 9:30 Pacific time is I host a free live group support space for folks who are dealing with long COVID to come in and just receive support in this way and know that they're not alone. Survivor Corps is a grassroots movement that I've collaborated with them many times over the years, and just really love their mission and the people who are at the heart of their organization. They have so many educational resources. And then of course Saybrook, we have our self-care YouTube channel, which by now we came forward with our mindfulness moments during the COVID pandemic. And this, in fact, for me, these 15-minute mindfulness moments that we would have a few times a week were supportive, one of the tools for support in my long COVID recovery. By now, we have so many available, including longer 1-hour meditations and talks. So that is there. And then the Gupta program is a really fun, this is a new resource that I just came into contact with to help with retraining the brain through mindfulness programs, and it's geared towards long COVID. So I want to hold some space for questions, and I think I'll just click over to our bibliography section as we're about 2 minutes left. But in case anyone is interested in capturing some of the sources here, again, I'll point out some of the blogs that I've published here about breathwork for long COVID recovery. So that's that Diaphragmatic Vagal Repair Method, and then the heart rate variability blog post as well. So I will leave that up for anyone who wants to maybe take a screenshot or is interested in that. Oh, and thank you, Sandy, for posting that link for our self-care YouTube channel. Yeah.